Good afternoon. Good afternoon. Happy Friday. We made it through another week. This week was a good week. And I want to thank you once again for tuning in to these press conferences. I'll be back tomorrow at 1 o'clock. We're going to give Nicole Alexander Scott the day off, but I'll be here with Dr. McDonald. And then on Sunday, Dr. Nicole Alexander Scott and I we'll be taping a Mother's Day message. And then starting next week, as we enter phase 1, I'll be doing these press events 5 days a week, not on the weekends, unless, of course, there's something urgent that has to be delivered over the weekend. So just like everything else, we're moving into phase 1, and this is going to change a little bit. Not a lot, but a little bit. And I want to thank the members of the media who have covered this 7 days a week, around the clock. They've worked with this new arrangement that we've come up with in order to keep everybody informed and also keep everybody safe. So thank you all, and I hope you get a chance to rest a little bit this weekend too. As you can see from the data on the screen, we had another 249 cases yesterday. Very sadly, another 11 deaths. Obviously, the toll that this virus has taken on the health of Rhode Islanders is extreme, and our hearts go out to all of those who've been sick, and especially to those who've lost a loved one. Tomorrow, the stay-at-home order will lift here in the state of Rhode Island. We will be the first state in the Northeast to go ahead and lift the stay-at-home order. We're going a little bit ahead of our neighbors, but that's okay. You know, some people have asked me, is it okay that we're going ahead of Massachusetts and Connecticut? The fact is, at this point, if you look at the facts on the ground, the data on the ground, we're doing better. And so therefore, we're in a better position so we can start to lift our restrictions a little bit sooner. And as you know, I'm very eager to get folks back to work. So the focus of phase 1, slow and steady, limit your social network, don't race out there this weekend, and let's just focus on getting folks back to work in a slow, steady fashion. Sunday is Mother's Day. It's one of the best days of the year. Happy Mother's Day to all the moms out there. It's a special day. It's a day for us to cherish and love our moms. But I'm going to ask you to remember that the guidelines around social gatherings remain at 5 people, 5-person social gatherings. That includes family, close friends. It's not a time to have big family gatherings. It is absolutely not a time to visit your mom in a nursing home or an assisted living facility. We're working very closely now with nursing homes and assisted living. They are still strictly forbidding any kind of visitation to nursing homes. So I know it's hard, it's very hard, but it's the right thing to do if we love our moms, and of course we do. Our moms have spent their whole lives taking care of us and making sure we're all safe. So it's our turn now to make sure that we keep each other safe and keep our moms safe. You have a wonderful weekend. Figure out a special creative way to love and cherish your mom, but keep your network small. And just remember, we're still only in phase 1 here. Later today, I'm signing an executive order that's going to lay out the rules around phase 1 reopening. Just as a reminder, the domestic travel order is still in place. That means if you travel to Rhode Island by any mode of transportation from any other state for any reason other than work or buying necessities, going to the hospital, and you stay here, you have to quarantine here for 14 days. Social gatherings, as I just said, are limited to 5 people. This is not the weekend or time in the next couple weeks to have a barbecue or a cookout or a big family gathering, but there are definitely some things to look forward to. You can go to the park. You can drive to the park. You can start to go shopping again. You know, as of tomorrow, retail stores are going to start opening again. That is so exciting that we're getting to this first phase. And if you're in a financial position to do some shopping, I'd encourage you to do that. But just follow the rules. Wear your mask, keep 6 feet away from people, don't go if you're sick, and don't crowd up in line or in the store. Later in phase one, I would love to be able to announce, frankly, as soon as is practical, outdoor dining. And we're working really hard, even over this weekend, to figure out how to enable outdoor dining. And I'll be providing guidance on that next week. The key to phase one is patience and flexibility. Patience and flexibility. I'll be making a lot more announcements. We're not going to, as we see things change, we're going to look to accelerate the rate of reopening. But we are never going to do anything that we think will hurt Rhode Islanders or risk putting us back to where we've just come from. So let's listen. I said yesterday, I feel I'm governing from a place of confidence and strength in the people of Rhode Island. You know what is the right thing to do. Wear your face cloth covering. Have it on you all the time. Wear it when you're out and around people. What I say is, you wouldn't leave your house without your phone or your keys or your purse or your wallet. So just put your face mask in your pocket so that if you run into people or if you're within 6 feet of people or if you're going to go to the store or the market, you can just put it right on. Wash your hands constantly. Keep 6 feet away from people. Call your doctor if you get sick. If you have been tested positive, isolate, even within your home to the greatest extent possible. We're going to be living with the virus for a while. Just because we're reopening the economy and reopening society doesn't mean the virus has gone away. It's still here. It's still dangerous. We still don't have a vaccine, and we still don't have great treatments. So that means we have to be really careful. But it also means it's time to come on out. Slowly, a step at a time. Go to the park. Go shopping. If you work in an office, if you can work from home, you should still be working from home in phase one. But if you left some files in the office, or you have to go and grab some things, or you have to go in briefly for a meeting, then do that, obeying the rules, and then go back home. In general, here's what I would say about all of these rules. Whether it's the rule around wearing face masks, the rule around obeying social distancing, the new rules for businesses around sanitizing and screening employees, we want to encourage, enable, and support voluntary compliance. That's the name of the game. We're not out to get anybody. We're not out to be heavy-handed in enforcement. We're out to help you keep yourself and your family safe and to help you keep your business open. So that means we need, expect, and will enforce compliance because that's in the best interest of everyone. But the focus is to make it as easy as possible for businesses to do that and to enable them, to provide them support and help and clarity, not a hammer or not leading with a hammer. And the same is true for every Rhode Islander. It's a very anxious time, and I'm deeply aware of that. So I don't want to add to your anxiety. I want to try to make life better and easier. So just do the right thing. Know the rules. Follow the rules. Do not try to outfox the virus. Don't try to outrun the virus. Don't think you're invincible. Don't think you can sneak and not follow the rules and everything will be okay. We know that's not true. Look what happened 2 weeks after Passover and Easter. More people wound up in the hospital. If you try to sneak around the rules, bad things will happen. But if you follow the rules, which are pretty simple, hard in some ways, but clear, we're going to be fine. We're going to get through this. We're going to get back to work and back to school and back to the beach. So follow the rules, look for ways to comply, be patient, be flexible, and just, we're all going to together have to get used to living with some uncertainty. I want to offer a little bit more guidance because we're getting some specific questions from businesses on how we're going to be enforcing these rules. And again, I want to be very clear. You should start by asking, how can I follow the rules? Don't start by asking, can I do this? How about that? Start by saying, okay, these are the rules. How do I get creative and follow them? If you want help, call us. Call 521-HELP, call DBR, call the Commerce, call Department of Health. We'll give you a hand. We are spending time talking to businesses all over the country, trying to help you follow the rules. But the executive order that I'll sign today allows Rhode, the Department of Health, to enforce the health and safety regulations on businesses, including graduated fines and including the ability to shut down a business who is found to be non-compliant. We're also going to have an enforcement task force made up of inspectors from the Department of Business Regulation, the Department of Health, and other areas of government that'll be educating businesses on safety, but they're also going to be conducting a lot of inspections, and they will be enforcing the regulations. They'll be educating businesses on safety. I want to be clear. We're not going to be out there trying to shut you down. We're going to be out there bending over backwards to help you stay open and to do it safely. But if you refuse and you're continually non-compliant and you get fine after fine, we will have to shut you down. And by the way, I hate the thought of that, and I hope we never have to do it. It is my desire to have as many people working as possible, as quickly as possible. So we want to give you a hand to help you comply so you keep everyone safe. I want to end on a happy note. Today is Military Spouse Appreciation Day. It's a big deal. Being married to somebody or being the partner of somebody who's in the military is a special kind of selfless service and sacrifice, often without any recognition. In some ways, it's probably the humblest form of service to your country. And we're always grateful for the family and spouse of our folks in the service. But this year, I know I am especially grateful because at this time we have just about 1,000 members of the Rhode Island National Guard deployed here in Rhode Island fighting this coronavirus. They're working around the clock in so many different ways, led by the capable and able leadership of General Callahan, who is doing a phenomenal job. So take a moment, if you're in the service, take a moment to say thank you to your spouse and your family. And if you are the spouse and family, on behalf of a grateful governor and a grateful state of Rhode Island, we want to say thank you. I want to thank our Navy, our Marine Corps, our Coast Guard families who are serving in Newport and all across Rhode Island. It's not easy, it's never easy, and now for so many reasons, it's especially hard. So you probably don't get thanked often enough, and you're not the one who are out there on the front lines getting the accolades. So I want you to know, we know you're there, we know you're the backbone, and we're so grateful for your service. With that, I'll turn it over to Dr. Nicole Alexander Scott and come back for questions.
Thank you, Governor. Good afternoon, everyone. Thank you for joining us today. I want to say thank you also to the Governor for the updates that she shared. Also want to say thank you as well with the appreciation that she mentioned. The Governor has really put together a thoughtful approach that's built around science and public health practices. And our focus is to continue to make it so that you have that information to guide your ability to continue to follow the rules. I agree that if we can continue to stay in line with those steps going forward, understanding the social distancing, the masking, the hand washing, knowing that that's what's needed to keep the virus from spreading from one person to another, we can continue to take these steps forward safely and with confidence. To get into our data, We have 249 new cases today. I want to thank the entire team of people that contribute to us evaluating these cases as well as identifying them. Our total number of positive tests is now roughly 10,800 out of the 85,000 tests that we have done as a state. There are 312 people currently hospitalized. Of these, 71 are currently in the ICU, and 52 are currently on a ventilator in the intensive care unit. Sadly, we have 11 additional COVID-19 associated fatalities to report. 2 of these people were in their 50s, 6 of these people were in their 70s, 2 people were in their 80s, and 1 person was in their 90s. These 11 people included 1 person from the Rhode Island Veterans Home, in addition to the 2 fatalities at the Vets Home that we sadly announced yesterday. The passing of these people and the people we have lost in the last several weeks is incredibly challenging and hard for the families involved. That's why it's important that we send out our hearts and prayers to them. Particularly with Mother's Day this week, which so many of us associate with warmth and smiles and gathering with loved ones, it makes it even more difficult for this time around. Please know that our deepest thoughts, prayers, and condolences are with you. In addition to sharing the data for the day, I really want to reiterate that the prevention measures we have been talking about are more critical now than ever. We've had all of this time during the stay-at-home order for people to get accustomed to what's needed and how to do it, and now's the time to really make sure we go forward. This is especially true about wearing your cloth face covering. More people being out is going to mean more people interacting face-to-face. If people are interacting face-to-face and are not wearing face covers, the respiratory droplets that I've spoken of that carries the virus when we talk, or sneeze, or cough, those infectious particles through the droplets would continue to spread. Infection rates would then go up, and then we would have to adjust the approach to loosening the restrictions. Nobody wants that to happen. No one does. With following the rules that we have, we can really make this progress go in the way we all want it to go. It is in our hands. We all have the ability to keep Rhode Island moving in the right direction and to help us reopen fully, safely, as soon as possible, steadily. To make that happen, we have to act responsibly. And we've spoken of the trust that we have in Rhode Islanders. That means wearing your cloth face covering, washing your hands throughout the day, implementing social distancing at least 6 feet apart from those who are not from within your household, and staying informed about what is and what isn't allowed in Rhode Island. We know that there are a lot of rules and that in some instances they have changed over time, which is important. We appreciate you being with us and following and continuing to be flexible, as the governor has mentioned. Finally, I mentioned Mother's Day earlier, and I want to circle back and say a few last words about the holiday. For everyone celebrating Mother's Day, when in doubt, keep the governor's words in mind. Keep your network small and stay close to home. Stay home and get together virtually on the phone if you can. If your mom, your grandma, your aunt, or anyone else you love is in a nursing home, that is especially true. You cannot pay a visit in person this weekend. You will not be allowed in, so please Don't even go, and think of other creative ways. Don't go to the window to say hi. We know how badly you want to see your loved one, but being there in any way can sometimes be even more challenging. We want to spend this time not just thinking about what can't be done, but looking creatively about what can be done. What can you do for Mother's Day? We want people to focus on that. You can call your family, call the mom in your life this weekend, do a video chat if possible. Just hearing someone's voice or connecting with them is such a tremendous gift, especially during this time. Many people out there are probably feeling isolated at times, but having the warmth and familiarity of a loved one's voice can be so powerful in addressing that in times like this. Another gift idea for this year is sending a promise. If you don't normally talk to your mom, maybe that promise is a weekly phone call for going forward, or maybe it's something you will do together in the future, or another form of a video chat that you can perform in together. We all need things to look forward to, and this is a great weekend to reflect on that and to be thankful for all the blessings in our life. So that's something that we can focus on together as we stay close to home through this weekend. With that, I'll get us started with questions.
Hi, everyone. Happy Friday.
Happy Friday to you.
We're going to begin with Ryan Belmore of What's Up Newport. Governor, hotel and bed and breakfast tell us they desperately need some guidance on when they can open reservations up to domestic travel customers. To reopen, they say they need several weeks' notice to build up the reservations, bring back staff, and to prepare. Can you commit to a date today for the lodging industry to make plans for their reopening?
Yeah, so first let me say I hear you, and I'm sorry it is so tough for your business, and we are going to find ways to help you reopen and also figure out ways to help you economically, because I know this has been an unprecedented time. Today, I cannot commit to a date. Here's what I can say. It's a priority for us. Technically, we never really closed hotels. Having said that, I understand exactly what you're saying. For the next 14 days, we still have the restrictions on domestic travel. So, we know that that is the case. This is at the top of our list for phase 2. So, we need to get through next week. And then this is at the top of our list for phase 2, right along with restaurants. So I guess what I'm saying is hang in there for another week. I'll be able to provide you much better guidance in about a week. In the meantime, know this, the Commerce Department is engaging with the hospitality industry, hotel owners, bed and breakfast owners constantly, and taking your feedback into account. We need to hear from you. What would be most helpful is if you could send us your ideas on the Reopen RI website around how you think it would be best for you to be able to reopen.
Steve Alquist of Uprise RI has our next question. People representing Latino, Black, and low-income communities have expressed concerns about your plans to reopen, noting that the negative impacts of reopening under COVID-19 will hurt these communities more severely. Do you share their concerns?
I'm going to let the doctor answer.
Do you want me to repeat it?
No, I'm good, thank you. Yeah, these are concerns that people are evaluating throughout the country. We know the communities that have been disproportionately impacted and are laser focused on making sure that those communities have what's needed in terms of access to testing, activation of appropriate case investigation and contact tracing, and the services needed for quarantine and isolation. And we're going to continue to stay focused on this area. The governor shared yesterday the items that we are watching that says we can go forward. It includes making sure that for our communities most disproportionately impacted, we have the resources focused on what's needed. We're going to continue to engage directly with communities, continue to hear feedback, and have a strong team that's in place ready to make the adjustments that are needed. There's work to do, and it's what we are focused on to help ensure that the communities hardest hit are addressed and supported during this time of reopening.
Our next question is from Hannah Dickinson of WPRI. The state is testing nursing home residents without symptoms, but has said it doesn't want to test asymptomatic people in the broader public yet because results are less reliable. Is this a double standard? Why or why not?
I appreciate this question. We've had this conversation. The message is still the same, that the test for COVID-19 works best on people who have symptoms. That is the primary approach. When we use the test on people without symptoms, it is less reliable, whether it is in a congregate setting, in a nursing home, or whether it's in the public. When we have used it in our congregate settings, it's because, as I've shared, we need to be as aggressive as we can be. And even though that test result is less reliable, if we can get information about someone who may be positive, it gives us the opportunity to act on it quickly. Because it's less reliable, when we get a negative result in those situations, we do not react to that. We don't say, okay, we're done because you're negative. We still consider the person to be at risk of being positive, knowing that it can change any day. So it's a tool that we are using. When it's on people who are not symptomatic, it is less reliable, but it still gives us something to work with. And because of what we've shared in our congregate settings and in other places where we really want to understand what's going on, we'll take it knowing the fact that it's less reliable and there's less information we can get or use when it's negative. It's helpful when it's positive because then we can react and make some changes based on that information.
Thank you. Bill Bartholomew has a question for you, Governor. Is there anything besides a massive increase in confirmed cases that you were monitoring during this initial weekend that may cause you to pause moving to phase one?
No, not really. And because if everybody rushes out this weekend, let's say everybody has big family gatherings and barbecues and picnics for Mother's Day, and let's say next week everybody rushes back to work, we won't see the negative effects of that for about 2 weeks from now. So the hospitalizations will climb 2 weeks after the behavior that would happen, say this weekend or next week. This weekend, I'm confident that we won't see an increase in cases because 2 weeks ago, we had excellent compliance with stay-at-home order and mask wearing and such. So at the moment, I feel good. I feel confident. You know, I couldn't imagine a scenario where we would start to see a big spike this weekend. As I said, 2 weeks ago, people were doing what they were told. The problem is if we don't all obey next week, and it's a risk, right? We're all sick of being shut in our houses. That's why I keep saying, take it slow. Because then 2 weeks from now, we'd have a problem, and that I think it'd be horrible to have to go backwards. So it's so much better to take it slow and increase and never have to go back. So that's how we think about it.
WPRO's Tara Granahan asks, what will the fines be if you find a business operating illegally? What's the cap?
Yeah, so it's a series of fines. It'll all be out on the website. It's a graduated step up, I think, to $1,000 or $2,000, and then after a series of after I think a few instances of noncompliance, in the most extreme instance, we could shut the business down. Again, that's not the goal. The goal is to say, how can we help you comply? And to help every business to be in compliance, because we don't want to be in the business of shutting businesses down. Having said that, we will enforce it because it's in everyone's best interest to follow the rules.
Next question is for the doctor. Paul Parker from the Providence Journal asks, what percentage of people who tested positive 14 or more days ago survived at least 14 days after testing positive? Is it fair to say they have recovered?
Yes, the overall approach to assessing recovery is to look at the 10,800 positive tests that we've had and subtract from that the number of people who have unfortunately passed away, which is the 399, and then take into account the 14-day lag that can occur. So as I had shared earlier in the broader context, Rhode Island as a state tends to have an overall lower mortality rate compared to our neighboring states. So a larger proportion of people, both in congregate settings as well as in other settings, are living after obtaining COVID-19. So that's something we will continue to assess, but our recovery number continues to go in the direction we want it to go, knowing that every life matters. And so there's definitely still improvement that we want to work towards.
Thank you. Our next question is from Jordan Mazza of ABC 6 News. The Warwick Police Union says the mask order is, quote, is likely to incite fear and anger in our community. Are you concerned about that possibility? What will happen if officers choose not to enforce civil penalties?
Yeah, it's a good question. So I'm not particularly concerned about that. It's my expectation that we will continue to be kind to one another and help and support one another to follow the rules. So as I said a few minutes ago, the name of the game here, the intention, is to promote and enforce and encourage voluntary compliance. It's in everyone's interest to follow the rules, and it's in Rhode Island's interest to follow the rules. So I hope that it doesn't incite fear. It's not intended to. Massachusetts has a similar order. Connecticut has a similar order. It's recommended by the CDC. We know mask wearing is effective. It's strange, to be sure. It feels a little weird, but it's very effective. It's very inexpensive, and it is so, so much better than having to shut down the economy. So that's why we decided to do this. What happens if police officers don't? I mean, this will be enforced. If certain police officers choose not to, the Rhode Island State Police will enforce it. But the goal is to rely on our public safety officials to de-escalate the situation. You know, we have excellent police officers and excellent Rhode Island State Police. They're expert in de-escalating. So it's their job to use their skills to de-escalate a situation, ratchet down the fear, encourage voluntary compliance, and use their judgment around when they would have to do enforcement. So that's how I think about it.
Nancy Thomas of RI News Today has a question about the living arrangements at nursing homes. She says most nursing home residents are now restricted to their rooms with about 2 feet of space around their beds. They don't eat together anymore or have activities. No one visits. Many watch these press conferences daily. What steps are we looking into to improve their living situations?
Yeah, what is shared acknowledges the fact that it is challenging. It's heartbreaking that we've had to take this approach, but we know that it's also life-saving. And it's why I mentioned how real it is that nursing home residents have 2 families. The staff who are there at the nursing home, the administrators, really are there caring for them and want to help provide support for their actual family to be able to engage with them in creative but safe ways to do that. The more we can work to get our hands wrapped around this, the more we can both think creatively to support our nursing home residents and the staff who are caring for them, and then hopefully be able to work towards steps that allow us to do more and to allow for additional ways to engage.
I want to say a few things. That is a heartbreaking question. You know, as you hear it, it is absolutely heartbreaking. And so to any of those in assisted living or nursing home listening, I want you to know we love you, we care for you, and we know how hard it is. I also want to say that we have a lot of plans that we're working hard on. The Director of Elderly Affairs, Rose Jones, is extremely focused on this issue of isolation and loneliness among folks in these communal care settings, and so is working really hard to figure out how to get creative with virtual interactions, just to allow our loved ones who are in those settings to have more interaction, more entertainment, more sensory interaction, even if it's virtual, for the next month or so. So we're working hard on that, and I expect more will be announced in the coming days and weeks.
Daniel Kittredge of the Cranston Herald asks, can you elaborate on how the decision will be made on when outdoor dining will be allowed? Will it be tied to specific triggers?
Not so much specific triggers. As I said, we've hit all the triggers to get into phase one, and we would like to enable outdoor dining in phase one. We just need a little more work. Frankly, we're working with restaurant owners and public health officials to try to figure out under what guidelines can it be allowed. And I'm very hopeful that Monday or Tuesday next week, I'll have much more to say about that. We're also working with municipalities because we're going to have to make more space available, right? Not every restaurant has outdoor dining, so we're going to have to figure out ways to enable the use of maybe sidewalks, streets, parking lots. Like we want to enable this for everyone. But the facts are clear that it is safer to do outdoor dining than indoor dining, so we want to go out of our way to enable it.
Thank you. Our last question today is for Dr. Alexander Scott. This is from Tanya Signori of the RI Echo. Does taking a zinc supplement help with prevention of COVID-19? Also, can it lessen the effects of COVID-19 and those that have tested positive? Are there any other vitamins or antioxidants that you would recommend?
Thank you for that, Tanya. There are many different medications, treatments, vitamins that are being explored with COVID-19. There are no randomized controlled trials that confirm that zinc or any other vitamins or antioxidants are actual indications or treatments that could be used for either prophylaxis or for recovery of COVID-19 at this time. But there are scientists throughout the world that are working on updates both from a vaccine standpoint as well from a medication standpoint. But I am not aware of zinc or other vitamins at this point having a difference in terms of preventing or treating COVID-19 from a study or trial standpoint confirming that.
Thank you.
Have a good weekend.
is in silent mode.
Hi, everyone. It's Jen Bogdan. We're here with the Governor, Dr. Alexander Scott, and Director Smiley. We can take your follow-up questions.
The conference is now in talk mode.
Hey, Governor Brian Crandall here. A preemptive Happy Mother's Day to everybody on the call.
Oh, thank you, Brian.
You're welcome. Hey, the Axios had a report that a number of states got shipments from the federal government of remdesivir, but that some of it may have gone to the wrong places, but that Rhode Island was among the states that got some of the drugs. Do you know anything about that, or is it being used in Rhode Island yet?
Yes, remdesivir has been used, and we had a conversation a day or two ago with the feds about it arriving, and it has been sent to the hospital that they calculated to have the most cases. And we will be engaging with the hospitals so that as it's needed for additional patients in other hospitals, we'll have the opportunity to have the other hospitals receive it as well. So once it's in the state, we'll be able to redistribute it if it's needed in other facilities.
Thanks.
Governor, this is Kim Kalunian. I know you spoke about fines for businesses, but can individuals be fined for not wearing a mask in a public place other than a business? You know, if they're out somewhere, how does that work for individuals?
Yeah, it is possible. We do want to, as the governor mentioned, really encourage wearing, and from my standpoint, make sure that folks comply, because it does make a difference. The science has changed as we've evolved through this, and masks are a necessary part to reopening, but we do reserve fining as an approach as we need, if we need to, for enforcement implementation.
Did she say it was $100?
Governor, it's Kathy Gregg. On April 10th, you signed an executive order providing immunity to hospitals and nursing homes. It expires today. Is it your intent to renew it? And if not, why not?
Excellent question, Kathy. The answer is yes, but we're still working really hard. I am going to renew it, but it's going to be much narrower, and we're still, as we speak, finalizing exactly the limits of it. So, you know, tomorrow or late tonight, I'll sign another one. We feel that it makes sense to provide some immunity, but now that hospitals are going to be going back online on Monday, we do not, you know, with their normal operation, I don't think it makes sense for there to be the broad immunity that we provided for the past month.
Are you narrowing it for nursing homes as well?
No. Hospitals. We're working hard to figure out the hospitals.
Thank you.
Governor, the revenue conference is happening as we speak, obviously, and we'll have those estimates tonight. What is next step for your administration on the budget next week now that the revenue stuff will be in?
Yeah, I expect it to be quite grim. I don't know how bad exactly, but it's going to be very bad. I don't know, Ted. I need to sit down with the legislators and make a plan. Here's the problem. We're not going to have any clarity until probably Memorial Day or the first week of June from the federal government on what the next stimulus is going to look like. And I talked yesterday to Senator Reed. I talked last night to Congressman Cicilline. We're in very close contact with Mnuchin. I think there will be another stimulus, which includes state aid, which will allow us to make up for lost revenue. Some people say, that that's going to be a $500 billion package. Some people say it'll be a $100 billion package. We keep hearing about more money for hospitals, more money for nursing homes, more money for testing. So we need to figure it out is the short version, but I'm not inclined to do much of anything for the next month, or at least not month, maybe 3 weeks, because there's so much unknown from the federal government.
Governor, have you had any conversations with Speaker Mattiello in recent times about the budget? Any even off-record conversations?
We talk once or twice a week, and we talk about what I just said to Ted. It's really hard. It's going to be brutal. It's going to be the hardest budget by far that any of us will ever have had to manage through. Obviously, everything's on the table, and I mean everything. There's just so much unknown. The best information we're getting out of Washington is that they're going to get something done around Memorial Day, plus or minus a week. So I think we're kind of in a holding pattern until we know that.
Hi, this is Amanda Milkovich. I just have a question. I just want to clarify something from Dr. Alexander Scott. When it comes to the antibody tests, are those also being offered to the healthcare workers? I was just looking at the White House criteria for states.
As we are doing the work that I've mentioned as part of the outbreak response for congregate care settings, where healthcare workers are, we are focusing on the diagnostic test, the PCR test, not the antibody test. Given the conversations we had earlier this week about our overall testing strategy, when we do the type of testing that allows us to have a scan of the population and get a better understanding about how disease spreads from a COVID-19 standpoint in the population, we will be focusing on the PCR tests, but using the antibody test to help us learn more so about how the antibody test works. Because there really is not data that supports using the antibody test on an individual basis, but it is helpful for teaching us more information at a population level.
So is that why you're not giving it the antibody test to healthcare workers? And that's in the guidelines. I was just wondering why that's not happening.
No, we are using it. We are not using it for our outbreak response, but for the surveillance picture, the long-term picture of testing, we are using both the PCR and the antibody, and it will include healthcare workers and a large proportion of our different sectors of our population.
So that you had the test, for example, you had the pilot program with the 4 Stop and Shops, and you're going to randomly select about 5,000 Rhode Islanders for the antibody test.
Antibody and the PCR test for that one. And for future ones, we'll be doing a similar approach at times, and it will include different types of workers such as healthcare workers, first responders. We're developing that list and working with the testing and validation task force to roll that out.
All right, but right now you're not doing that. You're just doing
Today, no, but the team is moving very quickly, so there will be ones in the coming days to weeks.
Okay, thank you.
Doctor, during the briefing, you talked about Rhode Island's recovery rate, but you didn't give a number. Could you please do that now?
I have more information that I can share on that. 14 days ago, we had 7,129 cases. We can't say anything definitively about the people diagnosed since then, but if you subtract the fatalities and people with long hospital stays from that number, 7,129, there are about 6,800 people that remain, and those are all people who have recovered.
Thank you.
What are the regulatory and legal constraints on discrimination against people who have a history either positive or negative testing with COVID-19? And in particular, there are news reports that the U.S. Army is contemplating banning recruits from induction if they have a history of recovery from COVID-19. What would happen if private or public employers decided to adopt a similar approach, setting aside the unreliability of antibody testing?
Right.
This is Michael Billow from Rhode.
Thank you, Michael. There's still a lot that's needed to understand from a legal standpoint. Our focus right now, with support from the testing and validation task force, is to make sure that people have a true understanding about how the tests work. The fact that it is less reliable when you use the test on someone who does not have symptoms makes it so that you would not want it to be the only approach to bringing someone back to work. It needs to be a comprehensive assessment. The fact that we know very little about the antibody test, particularly at an individual level, means that you would absolutely not want to have that be its own indicator for someone returning to work. We are still needing to learn more information about that test at a population level.
Well, how would you advise somebody who was, say, reluctant to get tested because they were afraid that it would mess up their plans to join the Army?
Yeah, we'll need to keep thinking about that. You know, we want to just make sure that everyone's educated on the test within itself. And these are all questions that we'll need to start exploring over time.
Okay, thank you.
Director, this is U.I. Sherman from Channel 12. I just have a question about the Veterans Home. I'm wondering, that facility for a long time didn't have any cases or deaths. Now it does. Based on your contact tracing, have you been able to determine how the virus got in there?
It's always challenging to identify a definitive source of illness. We do know that there are a variety of ways, sometimes a staff person, sometimes a visitor through one of the other roles, because there have been no visitors, but the people who are working that have to come to visit to the facility may have acquired it in the community and may not know it. And then sometimes it's oftentimes hard to tell, but more of the cases obviously were identified because we did the aggressive approach once we had one of testing all staff and all residents. And so that's why it suddenly became the number of people positive that were noted for the Vets Home that weren't noted previously. And it does give the opportunity to acknowledge that it had gone as long as they had without having a case that reflects ongoing good work that nursing homes are working to do.
So are you saying that you don't know specifically how it got into the Veterans Home?
Correct.
No. Thanks.
Governor, Tim and I are getting a lot of emails from folks who are starting to run out of 26 weeks of jobless benefits because they were already on. CARES Act extended it, but that does have to be rolled out, the extra 13. Do you have any sense from DLT on when they'll be able to start signing people up for the extra 13 weeks?
Yeah.
Hey, Ted, it's Brett. The so-called extension benefits are the very next thing on DLT's list. They're very aware of this issue and expect to be rolling it out shortly, as early as next week. You know, they've been ahead of the curve throughout this crisis in terms of providing benefits. We know that this is an issue, and they're all over it, hopefully by next week.
Thank you.
Got about a minute left.
We've heard from a number of people who were approved for unemployment and received benefits, say the end of April and the first week of May, but that leaves them backlogged for 3 or 4 weeks whenever they applied. Any idea how that's going to be resolved? Do they have to take any action, or will DLT just eventually make that up?
I don't believe they need to take any action, but I don't know the specific timeline on the catch-up payments.
I wanted to say Happy Mother's Day to both ladies.
Thank you, Paul. Thanks to all the moms on the phone.
All right, thank you, everyone. We'll be back tomorrow.
Take care.
Bye.
Thank you.